Hi everybody, it's Dr. Cary Yurkiw here. I'm the founder of True North Practice Management, and this morning we're talking about wealth creation for health professionals. Health professionals are experts at what they do, but often they struggle with things like finances, managing a business. It's just areas where health professionals are not experts in, and sometimes they delegate tasks to people who don't do a very good job for them, or they get taken advantage of by vendors that are trying to get their money, basically. I know because I'm a health professional, I'm still in practice. I practice part-time and have a busy part-time practice, but I've also worked in over 60 clinics over my career as a locum doctor and as a consultant. So I've seen many practices, worked with many different health professionals, and I'm going to share some tips with you today because we want to make sure our clients are moving in the right direction and prospering from all their work. So I'm just going to move over to our slide here, and if you're on YouTube, you'll be able to see my slides, but if you're on Instagram, you just kind of have to follow along. I do encourage you to go to YouTube and subscribe to our channel or our podcast. So health professionals are highly paid professionals. Compared to the average profession, I would say health professionals are more highly paid, and that's one of the rewards of being a health professional. I mean, you go to school, you have to get good grades. It's challenging in undergrad and competitive. You get into college, it's competitive, at least the first couple of years of med school, very competitive. Chiropractic college, dental, therapy. And what happens is, by the third and fourth year, you're already doing your practical work or residency, and then you graduate. And what happens is, you're an expert at treating patients, which is what you're trained to do. You're going to get highly paid for that, but then you're in the dark as far as how to run a business, your practice, your clinic, or even personally, how to manage your finances. Maybe you grew up with family members that are health professionals so they can guide you. Maybe your colleagues will help guide you, but they have their own situations that may not relate to you and may not be the same as your situation. So I've seen it so many times where I've seen an excellent doctor in practice, and yet behind the scenes, everything else is kind of a shambles. And so I thought one day it would be good to share some of the things I've learned along the way or I've seen and help health professionals to do better. So health professionals are experts at what they do, no doubt about that, in whatever field they're in. But they're not experts in other areas like business. So often health professionals make a lot of mistakes and eventually learn from their mistakes, or they don't learn and they continue to make mistakes until they get some help from a coach like me or a consultant or some type of mentor. The problem areas health professionals generally have are spending. As your income goes up, what happens is you start to spend more money, especially on things like cars or homes or trips or personal items. Sometimes the spending translated into the practice. So you start spending money on software or on equipment or things like that. So some of these expenditures are good because they support you and they support your growth. They also can produce income or equity, asset creation, which is good. We'll talk about that in a second. But sometimes there's extra expenses and nobody's really looking at that. And it can go on for months and years. Recently, I looked at one of my clients' income statements for this year and found at least $20,000 to $30,000 where we could save for next year. And so now in those categories, he has to dig into that with the staff to find out how they can improve on that, how to save and still get the same type of service from those vendors or the competitors. Sometimes health professionals make poor investments. They chase bad advice, stock advice, or investment advice and end up getting burned. or there's a lack of planning. There's just not a game plan on how to move forward and project forward income, expenses, asset creation. And so financial planners can do that, but you have to be careful of the financial planner that you get, because you want someone who's worked with individuals in your profession and at your income level, because then they can say, yeah, I know exactly how this is going to go. I've worked with clients like that, and they will guide you accordingly. Now, I'm not a financial planner. I'm a health professional myself, but what I consider myself to be is a quarterback. So this isn't financial advice for you, but it's more helping you as a quarterback, giving you some feedback, helping you to plan and get the right people on your team to get the results you're looking for. So what are the solutions? The expense side of things, going through the expense sheet, I'd say on a quarterly basis, both business expenses in your practice as well as personal ones, and just taking a look at where you can save some money, making some adjustments, taking action, and then reevaluating again in 3 months. That's reasonable for a busy health professional. No problem there. Saving, setting up a plan to save money. So you want your revenues to be more than your expenses, of course, and then you want to save money from that positive cash flow and put that money away for the future. Now, you can do some conservative investing with that. You can talk to a financial planner about that, and you might want to start planning for the future and how you're going to use those savings, because you just don't want them sitting there for a long period of time. So solutions could be investments, and those investments can be in areas like real estate, so personal real estate. It could be real estate for your business and your practice. It could be reinvesting in equipment. So equipment that'll help you to produce more income, get better results in your clinic. And then equity and asset creation. So, just building up your net worth over time. The benefits of coaching, why hire a coach? I had 3 coaches over my career. Each one brought a little bit different skill set to the table, and I was able to learn a lot from them, not just with my practice, but personally I developed as well, because you're working with someone, the spotlight's on you, and what happens is you start to think about that, and there's some accountability there to make some changes and improvements. So it does really help. So a coach will provide accountability to stay on the right track, present new ideas and solutions, help you to form new habits, and habits do take time. 6, 10, 12 weeks of regular effort will establish a newer habit. Overcome challenges and obstacles you're currently facing. And often that gets frustrated because you keep dealing with the same thing. You're like spinning your wheels and you want to make some changes, but you keep kind of butting your head against the wall. And a coach will help you to overcome those challenges, achieve your goals and dreams, and get back on track as far as your mission and your vision of why you're a health professional in the first place. I work with healthcare professionals like doctors, dentists, therapists, chiropractors, who are primarily in private practice. So they're running their own practice. Maybe they're an associate, but they're in private practice, not so much in institutions, and they have to manage a business. So that's who I work with. Those are my clients. And right now I'm offering a free consultation for healthcare professionals that are in private practice, a 20-minute consult. You can click on the link below or the bio here on social media, and then just go over to free 20-minute consult, enter some details, what your obstacles are, your goals and dreams, and then we can do a call either on Zoom or a phone call, whichever's better for you, and then just discuss what your particular circumstances are, whether it would be a good fit to work with me, and then take some action to overcome obstacles and achieve your goals. Thanks for joining me today, and we'll talk to you guys again on Monday.